My name's Sarah Hansen. I'm an adult geriatric nurse practitioner at Cabin Creek Health Systems. So I moved here to West Virginia about 7 years ago. I actually came here as a student. I went to school in Atlanta, Georgia, and we were sent up here on a clinical rotation, and I kind of fell in love with the state and the clinic. So then I moved here, and I've been here ever since. So here at Cabin Creek, we are offering an advanced practice provider postgraduate primary care fellowship. So this program is a year-long transition to practice program that helps facilitate that really difficult bridge from going from an academic environment to practicing in primary care. So throughout the year, we offered structured mentorship and precepted clinics, as well as weekly didactic sessions and specialty rotations to really learn how to be a primary care provider and provide the often very complex, comprehensive care for our population here in rural West Virginia.
So for me, trying to find a program that bridged the gap between being an NP student and then being a full-fledged provider was super important. I graduated NP school not really feeling super prepared for that role, and I felt like the residency program was great in building that confidence.
I felt really nervous going into practice. I knew that I was worried I wouldn't have enough time to spend with patients, and I knew that I was going to feel really scared a lot of the time and feel like I was missing something. And I wanted to have a period of time where another experienced clinician saw all of the had all the data, went in and saw the patient with me and made sure I wasn't going to miss something, and then I could learn from every single patient encounter instead of bungling my way through it. In addition to the fear that I had about missing something, I also knew that the amount of stress I was going to be under in starting a new career was going to be really high, and I knew that having another set of eyes on all of my patients was going to really lower the amount of stress that I would take home every day.
This program is designed for newly graduating nurse practitioners or physician assistants who are passionate about providing primary care to an underserved community here in West Virginia.
So personally, I love West Virginia. I've been coming here since I was a kid. My family has a cabin outside of Morgantown, so I've always loved the state. So it's great to have a reason to actually live here. I love the outdoors. There's tons to do here. There's kayaking, there's hiking, lots and lots of things to do in the summertime. I also live in Charleston, which I can speak to. I live in the East End, which is near the Capitol. So the city is super accessible. Even though it's small, we have a lot going on, especially in the summertime. There's festivals, there's concerts, there's tons of restaurants. New ones are coming in every single day. So there's just actually a lot to do, even though it's a small town kind of vibe.
So I've been traveling to West Virginia for years now. I am an avid rock climber and hiker and mountain biker, and it was really the place that I wanted to be. And living around the Charleston and Fayetteville area, it's a mecca for outdoor activities. So the time that I spent outside of the clinic, I could really fill with all the activities that make me happy.
So for me, the residency program really instilled confidence. That's been the biggest game changer as far as translating to my practice as a full-time nurse practitioner. So I know this sounds kind of generic, but I do feel like we had positive patient experiences all the time, even every day, as ridiculous as that sounds. But I find that patients really like that we had time to spend with them, and that was huge in the residency program because we slowly ramped up our schedule. So a lot of times patients just want to be heard, and we were able to offer that in the program.
Going back to the amount of confidence that I have now, there was a patient that really scared me, tripped me up, and then I had resources in place. I called one of the providers that I work with, that wasn't actually in the office. It was one of our psychiatrists, but I had a phone conversation with her about the best first steps, and then she followed up on it. But that patient, if I hadn't had an expert to talk me through what was the person that was in the room, the presenting problem, I wouldn't have slept that night. I wouldn't have slept that week.